Joining us this morning is Dr. Colleen Fogarty with the University of Rochester Medical Center to discuss how we can stay on top of flu season this year. Dr. Fogarty, thank you so much for joining us this morning.
Good morning, Amal.
All right, let's start off with what you're hearing about flu season this year.
Great question. As you know, the Centers for Disease Control and Prevention is constantly monitoring flu activity. And on Friday, they just released data showing an early increase in flu activity in most of the U.S. We might be looking at an earlier flu season than typical. Early data shows that in the United States Southeast, the flu cases are a bit higher than usual. We know we can't predict with certainty how the flu season will shake out or how many people will be affected, but we know the last 2 years had much lower flu activity due to the masking and social distancing related to trying to prevent COVID.
So what are some of the symptoms we should be looking out for?
So fever, cough, sore throat, generally feeling ill and tired. Those are the typical symptoms with influenza.
Okay, and what are some of the things we can do to protect ourselves and our families?
So definitely getting vaccinated. We're now in the peak time for flu vaccinations. The best time is before the end of October, but if you can't manage to get it done before then, you'll still get some protection even if you get a later vaccination. Your healthcare team or your pharmacy can get you the flu shot without any trouble.
Great, and can anybody get vaccinated?
Age 6 and up, and that's recommended for everybody. Also, if you're eligible for a COVID booster, you can get those two at the same time.
Oh, that is good to know. And then what about masks and distancing? I know we're not so much adhered to that anymore since the pandemic has progressed, but should we still be masking?
So there's not a universal recommendation for masking, but we know that it's still effective in preventing the transmission of all kinds of respiratory illnesses, whether it's COVID or flu. If you're going indoors to a crowded space in the cold weather, masking can definitely protect you from respiratory infections. And if you're sick, of course, it's always best to stay home until you're healthy again.
All right, Dr. Fogarty, some very important information there. Thank you so much for joining us in studio this morning.
Thank you.
We'll have more information and resources on flu season over on our website, rochesterfirst.com.